I'm clicking go live now.
Good afternoon and welcome to our final session of the day for Aesthetic Medicine Virtual Week. I'm really excited to be joined, technical issue, this afternoon by Mr. Arturo Almeida, and he's going to talk to us about treating unsightly thread veins and vascular blemishes safely, fastly and effectively. So we are going to go over to him now. He's a consultant surgeon, internationally renowned keynote speaker, medical trainer, and expert in minimally invasive and non-surgical treatments. So I'm really looking forward to this talk. I hope you enjoy it.
Good afternoon. I'm Heather from Thermavein, and we're delighted to have Dr. Almeida with us today, a world-leading surgeon and lecturer who specialises in the management of both cosmetic and surgical veins. Dr. Almeida is here to talk with us today about his experiences spanning over almost 2 decades. Welcome, Dr. Almeida.
Well, thank you, Heather. I'm delighted as well to be here with you this afternoon and also with this fantastic audience that's been put together by Aesthetic Medicine Live to talk about something that I'm very passionate about, which are veins.
So what are cosmetic veins?
Cosmetic veins are unsightly veins that are sufferable both men and women that can happen everywhere in the body, the face, the chest, arms, buttocks, legs. But to be honest with you, the ones that will bother the most to our patients are the ones located here in the face and the ones in the legs. And this is particularly true now on the heat, the hot season that's starting now. You ladies, it's like you forget about your legs in the winter.
Yeah, we do, but it's shorts and it's short skirts.
I know, and then, it's like all of a sudden with this sun, it's like, oh my goodness, these veins that I hate when I'm wearing my shorts. Okay, this is the proper time to treat those cosmetic veins, yes.
So we need to know more.
Oh, yeah.
So what procedures have you used to treat thread veins?
I think that's a really good question, Heather, because it's true there are a number of different therapies available to treat cosmetic veins. And I'd like to start with microsclerotherapy, which is a great and well-established technique. Mm-hmm. Here, we inject a substance within the vein to be treated, and it will literally instantly disappear, as you can see in this video clip. It's just an amazing thing. You put the needle in, inject the solution, and you see?
Fantastic, wow.
Well, it look amazing. Yeah, it's amazing. But let me tell you something, and this is really important. To achieve the desired results with the sclerotherapy, it's really important to understand that you must provide a number of sessions until you achieve the desired result.
Okay.
But it definitely, microsclerotherapy is within my toolbox to treat cosmetic veins. That's one thing.
Fantastic.
Second, light veins devices such as IPL, laser, and to be honest with you, I don't have so much experience with IPL, but I know people out there achieving good results with this treatment. And lasers, I mean, what can I say about lasers? To be fair, lasers are an amazing tool to deal with vascular and vein problems. But in my experience, I found laser, when talking about cosmetic veins, because this is the topic of today, when treating cosmetic veins, I found to be quite painful for my patients.
Okay.
And obviously this is something that they don't like. And at the same time, sometimes I had a higher recurrence rate that it was definitely higher than I expected for my patients. So this is the reason why I decided to implement the next therapy, which is thermocoagulation, which is a radio frequency energy that is beautifully delivered, as you know, by equipment known as Thermavein.
So please tell us, how does Thermavein work?
Thermavein is an equipment that generates energy, and it's not any energy. It's a 4 megahertz radio frequency that is delivered via a very small gauge needle, and this energy will produce a denaturalization of the proteins in the vein wall, which eventually will change the structure of these proteins, and this will make the vein walls to stick together, and therefore the vein will be sealed. Obviously, and this is easy to understand, if we seal the vein, the blood can travel down the vein, and it gives the appearance of the immediate disappearance of the vein, which is a great effect, as you can imagine. So, for the procedure itself, after obviously preparing the patient, it's done with 3 simple steps. Step 1, we put the probe on top of the vein to be treated. Step 2 is just to deliver the energy by pushing the foot pedal. Step 3, move along and repeat the procedure. It's as simple as that. And let me show you a video of an actual treatment done in one of the many patients that we treated at Thermavein. And these are veins, these are no veins that are visible through a cross-polarized light device that also amplifies the veins to make the procedure easier for us. And as you can see, we bend the needle here to aim the veins perpendicularly, which is an important thing. And then, as I said, step 1, step 2, step 3, we're just pushing on the foot pedal. And as you can see, and it looks like magic, isn't it?
It's incredible.
It's like, you know, the veins literally disappear and create this wow effect. And I still remember, I mean, it's been already a number of years that I've been a Thermavein user. And the first time I saw this effect, I said, wow. That is amazing. But let me tell you, even today, after all these years using this technology, the Thermavein still just, this is this wow effect on me, which is, I think is just great.
Well, it's amazing to be able to have a treatment done so quickly. And why would you want to live with all of those thread veins?
Yeah, exactly. You know how long does it take a session to be completed?
How long?
It's just 15 minutes, 20 minutes the most. And say that you come into my clinic because you have a thread vein in your face and then you want to just get that treated.
Yeah.
I mean, it takes literally 5 minutes the most.
Fantastic.
It's just fantastic. And for instance, you know,
Look
this
at
image
this.
here is taken, the photo is taken immediately after the treatment. And you can see the veins are gone, are simply gone.
Incredible.
Yes, there is some sort of reaction, some sort of subepidermal reaction. As you can see, this redness on the nose, which is normal, and this is something that we should explain our patients before starting the treatment. But that erythema, that reaction lasts for normally just half an hour, and then it's gone. Few patients will experience some little crust on top of the vein that has been treated, and sometimes they just ring you and say, hey, listen, this is normal. Well, it is normal, it may happen. Good news here is that, you know, the crusts didn't just fall off eventually in a matter of a week or so, and then the veins are gone. I think it's great. Yeah, it's
amazing.
great.
I know, to see them just disappear in front of your eyes like that.
Yeah, and can you imagine, the effect that creates in the patient, that, they come to your clinic with the blemish that's been bothering them for years, and then all of a sudden you can make it disappear as easy as that. And the good thing here, because obviously we as medical practitioners, particularly in my case being a surgeon, it's key to take always in consideration the safety of any procedure that you offer. That's a key thing. And this is a very safe procedure, because remember, I said it's a 4 megahertz energy.
Yes.
So it's the precise energy to deliver that effect to the proteins at the vein wall. And that's another thing. The target is not the blood, as is the case for light-based devices such as laser, IPL. No, the target here is the vein wall itself. So we achieve a vein sealing, and so the recurrence rate of these lesions that we treat is extremely low, at least not just in my experience, but all the people that have been using Thermavein worldwide, because this technology is available not just here in the UK but worldwide.
Yes, fantastic. So what other parts of the body can we actually use and treat Thermavein?
Good question. As I said earlier, cosmetic veins can be found all over the body. So strictly speaking, I can use Thermavein all over the body, and that is my experience. I haven't had big issues treating veins in any areas of the body, which could be different, like for instance, again, lasers. I've treated people with problems in the upper eyelid, and if you know this, I'm pretty sure that you do, the skin at the eyelid level is the thinnest skin in the body.
Yes.
So if you deliver too much energy, you may produce a little hole in the skin, which is something that you obviously don't want, but let me tell you, patients will hate that. So by using this low energy, you are effective in treating these lesions, but you know that it's going to be safe for your patients.
Fantastic.
But I'd like to take the opportunity of your question to make two important points here.
Yeah.
One, when dealing with cosmetic veins, it's key to understand there are basically two types of cosmetic veins. Leg veins and the rest. The reason is because if you approach a thread vein, saying in the face, okay, you may need just one session, that's it, end of the problem. But if you are aiming to treat the same thread vein but located at your legs, that's going to be a completely different problem, and they may need more than one session, or sometimes another therapy to use at the same time. And this is really important. This is something that I really stress to my delegates in the courses that I do to treat cosmetic veins. The second key idea, in my opinion, is that when treating cosmetic veins, you need to make sure there is no underlying condition within these veins. For instance, the example of rosacea.
Yes.
Exactly, rosacea is a huge problem, and it's a very common, problem that we see in our clinics.
It is.
The point is that veins in rosacea patients, a very common, problem of many other symptoms associated with rosacea. If you don't treat rosacea first and you just go straight to treat the veins, the results are going to be disappointed. Patients are not going to be happy, and what's even worse, they will tell you, well, this is not working, that is not for me, blah blah blah. So it's really important, and this is the reality with any of the treatment that we offer, right, to have this medical history well done, to make sure there is nothing but these unsightly veins, and then use Thermavein to treat them.
Fantastic. And there's also like skin tags you treat also, and cherryangiomas.
Oh, thank you for reminding me. Sorry, I forgot. I mean, cherryangiomas, there's red spots, that happens all the body up to the age of 40, and nobody likes them.
I think I've got a couple of them.
Well, be my guest. I mean, I'm happy to treat you at any point. So,
Thank you.
the thing with cherryangiomas, it just works fantastic. I mean, before Thermavein, I used laser, and it works really well. Don't get me wrong.
Okay.
The point is that I needed to just numb the area with some numbing cream, or sometimes injecting local anesthetic. Whereas with Thermavein, there's no need for any anesthetic. It works just great. It's just fantastic. Skin tags, yeah, you may say, well, skin tags are not vascular lesions. We're talking about cosmetic veins here.
Yes.
But let me tell you, it does work, and it's a very common thing. And some of your patients are going to have skin tags in the face and say, oh, can you help me with that? Well, yes, you can. With Thermavein, definitely. And this is also important because we're doing business here, it's a nice way to get a quicker return of your investment.
Yes.
Okay, which is I think is great. And actually, I've been using Thermavein for many lesions. Important, you need to make sure that whatever you're treating is appropriate, meaning that if you have any doubts about the skin lesion that you are aiming to treat, make sure that either you have the knowledge or you get a dermatologist to help you with the proper diagnosis. That is key.
100%, yes. And I would also warts as well, because that's quite a problem too.
Yeah,
So,
exactly. Yeah, and warts, I've been successful treating warts.
Yes.
There's some people that are making a full practice out of warts, believe it or not. And again, because we're delivering less energy here, there's less chance to damage the skin, which is absolutely brilliant. So for instance, you can see there, in the screen, this is the screen that you can actually see in the piece of equipment. And there's a full set of preset programs that will help you with the technical part. You don't need to struggle to know, okay, do I need to change the settings? Do I need to change something? No. The equipment does that for you. But as I said, yeah, exactly. You can see warts and injectations in the leg and the face, different energies, different lesions, different energies. Fibromas, yes, but with the work of caution that I just mentioned to you. It's really important to make sure that whatever you are treating, that you not just feel confident with the technique alone, but with the medical diagnosis, definitely.
Of course, 100%.
Yeah.
Fantastic. So why do your patients love it so much? Please tell us.
Well, I think that after this talk that we had, you may have an idea about that. That's a little bit. Okay, first of all, is the wow effect.
Yes.
Similar that happened to me the first time I saw these.
Yeah.
They're just amazing. Literally, a patient that I treated the other day said, well, no, you know what? It's just incredible. I've been just bothered by this blemish that I have in the nose for so many years, starting to think about put the makeup on every morning, and then it's just gone in a matter of seconds. Yeah, so it's just great. And what else? That's the first thing. Second, I mentioned this already. It's a pain-free procedure, which is great. Because do you like pain?
No, I definitely don't like pain.
And
Although I've had children, but even so.
Nobody likes it, right? So
No.
if you can deliver results
Yeah.
in a safe manner, but pain-free,
Yeah.
it's a win-win situation.
I
isn't
know,
it?
completely.
So third reason that my patients love it is that for face veins, and this is important, I'm not going to say leg veins, face veins, in many cases, in my experience, is about 60, 65, 75, 70%. They just need one session.
Gosh.
And the blemish is gone, the threat vein is gone.
Amazing.
Which is great because they don't have to come back. So the way I do it in my practice is say, okay, I do the treatment today, come back to see me in 6 weeks to do any touch-ups if needed. But you know what happens in reality? Most of my patients will ring me and say, listen, it's like, do I really need to go and see you? Because I don't see anything.
Fantastic.
So this is just great. So it's the immediate disappearance of the veins, pain-free, and the recurrence rate. You don't have to be bothering about thinking about seeing the doctor again. And so one session is gone. It's great.
Amazing.
And that's for patients. You asked me about for patients, but I think it's important also what about for us, the practitioners. Well, it is a really profitable treatment. And once you pay off the equipment, which is something that is not complicated to do, it's all profit. Because the consumables used by Thermavein cost, believe it or not, less than £1.
Yeah.
And the rest will be profit. And there is no need for expensive consumables. It's a low maintenance. I have my Thermavein for 6 years. And literally, I can tell you that I never needed to take it back to the company and say, okay, it's not working, something, it's very reliable. And I think this is key for the times that we're currently living of COVID-19, all this uncertainty about lockdown was going to happen. it's a real portable device.
Yes, it is. It's
I
very
mean,
small. I was quite surprised how tiny
yeah,
it is.
exactly.
There we go.
Yeah,
There's
look at that. I mean, it's really, really tiny. You can take it literally everywhere. It's not heavy stuff. Quick setup. You can set it up in a matter of minutes, and then you have this really nice interface that will tell you, you don't have to be thinking about settings. You just press the button, ready to go. That's amazing.
Fabulous. Well, it looks like we've got a few.
I have had a venous lake right here, reduced dramatically after the treatment. This I cannot believe. It's fantastic.
The veins have definitely gone. So yeah, the treatment works well.
So we've got a few questions here
Okay.
if we get started. So is this also applicable for the body, which we've just obviously gone through a little bit there? What is the aftercare, which is something we didn't touch on? How many treatments needed and how far apart?
Okay. First of all, first question. Yes, you can use it anywhere in the body, and I've used it in all places that you can imagine, and it works. That's one question. Aftercare, that's a good question, and I'm sorry because I completely forgot about. I got too excited about talking the technology.
Yes.
Maybe aftercare is very simple. First, you need to make sure that the patient understands there's going to get some redness in the area that you treated. Very few occasions they will have some little swelling, so I just advise them just to avoid the sun as a precaution, not because of lasers. It's not the same point as laser, because remember, we're targeting the vein wall, we're not targeting the blood. So there is almost zero likelihood of getting hyperpigmentation or pigmentation. And that's just basic care. I mean, nothing special. Although if you use good skincare, you use good skin pads, and as you know, they're not the same, right?
Yes, I know the Skin Matrix HD micellar pads for sensitive skin with licorice root extract and chamomile. They're fabulous because they don't have any alcohol, no parabens.
Yeah,
so,
you're right.
So again,
you're absolutely.
which are lovely for the skin.
Exactly.
And that's something very simple. That's all that's needed after the treatment. Usually.
Nothing special.
Yes.
And then, how often can you repeat the treatments? As I said, my approach is to do the treatment, wait 6 weeks, and you may wonder why 6 weeks. Well, there's a process that takes place after the vein walls have been sealed. You are cutting off the blood supply, and eventually the vein will disappear. But it takes some time until that happens. So you want to make sure that when you see the patient back into your clinic, whatever you're seeing is the actual result. So it's better to wait. At the beginning, I waited 4 weeks, but I found sometimes was not enough. So it's good to say 6 weeks. That's something that you explain clearly beforehand, and that's it.
Another question here. So, what is the range of treatment price for providing the treatments?
Okay, that's a good question.
It is a very good question.
Yeah, because obviously we all know about want to know about exactly the return of investment.
Of course.
Overall, I mean, average here in the UK, the session, which is, as I said, 15 to 20 minute session, runs between 150 and 250 if it's done in a purely aesthetic clinic.
Okay.
When this procedure is done in a medical setting, in a medical clinic, I know there's some people who's charging up to 425 per session. And remember what I said earlier, once you pay off the equipment, it's all profit.
Yes.
You don't have to buy any stuff, you don't have to buy any products.
Yeah, just a little probe. Which is
The
under
little
£1.
probe, which is less than £1, literally.
It's fantastic. So, right, what else have we got here?
Any more questions?
We have. So, I'm an advanced electrolyst and have just used So, I'm an advanced electrolyst. The technology compare.
Well, as you said, or this person said, is electrolysis, is a different technology. The energy delivered by electrolysis is way higher than the one delivered by Thermavein. And this is simple. The higher the energy you deliver, the more likelihood to produce any harm to the surrounding skin, and then therefore to leave some scarring tissue.
Yes.
With 4 megahertz of radio frequency, you can't get wrong. You can't be wrong. So that's the main advantage, in my opinion, with electrodes. Yes, you can achieve some results. Yes, you can achieve, the disappearance of the veins. But by delivering such a high energy, you're also risking the cosmetic results. And at the end of the day, we're talking about a cosmetic treatment, right? So our patients want the best cosmetic results.
Yes. And what about hyperpigmentation or hyperpigmentation?
Well, that's a good point, because
Yes,
that's
we
an
didn't
issue.
cover that.
Exactly, that's an issue with light-based devices. Again, the target of our treatment is not the blood, as is for laser. You know, the target are the proteins within the vein wall to eventually achieve the sealing of the vein. So we're sealing the path, if that makes sense.
Yes.
We're not targeting whatever goes through the vein, and by sealing the vein, we create that immediate effect of, okay, wow, it's gone, okay?
Yeah, of course.
Because we are not aiming the blood, the possibility of getting any hyperpigmentation or hypopigmentation is, I won't say zero, because I've learned after all these years practicing surgery and medicine, that in medicine, nothing is impossible, nothing is zero. I mean, that's my experience. But I have to say that, you know, the possibility of that happening is extremely low compared to other procedures. You know, like for instance, in microsclerotherapy, yes, you can get some hyperpigmentation, but it's not directly related to the sclerosant agent injected. No, it's related to the blood that gets trapped within the vein, and it's the blood that actually causes the hyperpigmentation.
Right, yeah.
So, because we're not targeting the blood, we're trying to keep this risk extremely low.
Yes.
If that makes sense.
Actually, this is lovely. I love ones like this. Someone said, I have had clients burst into tears after this treatment because the results are so instant.
Wow.
That's what we want to hear, isn't it? Hey?
Oh, absolutely. And
Love that.
And this is the experience. I mean, and
Yeah.
you know, you can't please everyone. I mean,
Yeah.
I know there's some people that's not going to be happy.
Yeah.
I know that, you know, but let's face it. I mean, this is the world. I mean, I can't please anyone, but I know that with Thermavein, I can deliver an effective treatment.
Yes.
And you know, cases like that is, like I said before, you know, I remember clearly as if it was today, this lady that was so you know, so emotional, say, oh my goodness, I mean, you got rid of this thing, you know how much that bothered me, that I had to be thinking about making it up just to conceal it. If you touch one life in your patients in your clinic, that's worth it. At least that's the way I see it. I mean,
100%
we are here to help the people. We're not here just to make a business. Yeah, we're in business, but it's about helping them. And for me, the best payment is to get that job done.
Yes. And also about contraindications.
Okay.
So how long between combined treatments would you leave?
Like you mean
If you have the treatment
sclerotherapy?
done and you're
Okay.
having another treatment time
Yeah,
that come in?
exactly. For instance,
How long
and
would you
this is a
leave?
good point because
It
for
is.
leg veins,
Yes.
and I think I forgot to mention this, leg veins, Thermavein is still an incredible tool, but only used in conjunction with microsclerotherapy.
Yes.
And that has been my experience. And let me share this with you. When I first got my equipment, years ago, my goodness, I mean, time flies. I remember that I was told that, you know, you can use Thermavein with any veins in the leg, in your legs.
Yeah.
So I did, because, you know, I was doing veins for many years. So I said, okay, let's do it. And I have to be honest with you, I was a bit disappointed at the beginning when I changed my approach, and when I did first, as I always, you know, microsclerotherapy to deal with the bigger veins, to shut down the blood flow first, and then to tidy up, that makes sense, with Thermavein, the remaining veins, it works just fantastic. And then about the time gap that you leave, I recommend to leave between 4 and 6 weeks. So all the process, you know, because sclerotherapy, and this is not the time to talk about that, works in a completely different way. There's going to be an inflammatory reaction and so on. And this is something that I explain with a great deal of in terms of my training courses. But it's a different thing. So, and but with Thermavein, we need to make sure that the vein that we are treating is, say, pure, meaning that it's not surrounded by any inflammatory reaction. And that's the reason I leave 4 to 6 weeks. I prefer 6 weeks, to be honest, to perform the treatments.
So I think one more question. Have we got time? So can it be used by an aesthetic practitioner or a non-medic?
Okay, that's kind of a tricky question, I would say. I mean, I think my answer to that is yes, because from the technical point of view, they can use it, but always under supervision of a medical practitioner.
Yes.
That's the way I see it. Because,
Absolutely.
as I said earlier, it's about the safety of our patients. It's not just about the technique. To be honest, anyone can do this. I mean, it's so simple. Step 1, step 2, step 3. But it's about, okay, am I being safe with my patients? Am I delivering the great thing?
I totally
so
agree.
that's my approach, and this is what I definitely recommend to everyone.
Thank you so much, Dr. Almeida.
You're so welcome. It's been a pleasure.
It's
Thank
been
you.
great. We've loved it.
Yeah.
And thank you so much. And on that note, we